So we've heard from a lot of patients who are enjoying the benefits of being pain-free. Well, now I'd like to introduce you to a podiatrist who uses amniotic tissue in the healing process in his practice. Please welcome Dr. Lou Cileberti.
Hello.
Lou, how are you?
Good, nice to meet you.
Nice to meet you as well. So how long have you been using this therapy?
I've been using this therapy for about 4 or 5 years.
Okay, so you first heard about it how?
First approached by a company rep who had essentially come to the office and said, hey, we have this new technology that's available to us and it's something that you may be interested in for your patients.
And when you first heard about it, what did you think?
I was skeptical, I was curious, I was interested, but I was definitely skeptical.
Why?
What they were promising seemed so extreme to me, and I wasn't sure that this was something that was even possible, and there were a lot of promises that were being made.
Promises like what?
Faster healing, decreased inflammation, less pain, and overall better outcomes.
Which sounds like an ideal dream.
Absolutely.
So you started introducing it to your practice, and what have you seen?
I've seen amazing results. I've seen all of that. Decreased inflammation, improved healing, faster healing.
Really?
Yeah.
Now, will you use it before, during, or after surgery?
I usually use it intraoperatively, which means during surgery. On occasion, I've used it before and after surgery as well.
So explain to me, what is your practice like?
So my practice is a foot and ankle practice that encompasses pretty much everything foot and ankle that you could think of. It's a high surgical practice. So I do a lot of trauma, I do a lot of sports medicine, and then I do a lot of elective surgery as well.
So people come into you, I sprained my ankle, you'd be the guy that I would see, right?
Yes. Yeah.
Now, is it better to have amniotic tissue therapy as soon as you have a trauma, or does it make no difference?
You know, I thought for a while that it didn't make a difference, and what I started to do is I would use these amniotic tissues that we had available to us at the actual time of the trauma, so as soon as I would get the patient. And what I saw with that was decreased inflammation, which in the trauma setting is huge. If you have decreased inflammation, you decrease pain and you improve healing.
Right. Now, why aren't more people using this, do you think?
I'm really not sure. I think it's a new technology that has not really hit mainstream at this point,
right.
And it's something that is slowly evolving.
And what do you think the future of medicine is with this discovery?
I think it looks promising. I think it looks very promising. I think that this is a modality that we can incorporate into how we treat patients in the office, in the surgical setting, and it shows a lot of promise.
Have you seen any negative side effects?
I have not. I have not. That's something that I've been asked before, and I haven't seen to date a single reaction from the products.
Wow. Now, tell me a great patient story. Do you have one?
Yeah, I do. I have countless. I'm going to focus on one that pops into my mind immediately. A woman that had come to me who had leg pain for years. Neuropathic type pain, so this was more of a nerve type of an issue. She was complaining of numbness and tingling in her leg. And what I did was basically put an incision on her leg, isolate one of the main nerves in her leg, decompress that nerve, which means I freed that nerve from scar tissue.
Okay.
And after doing that, used the amniotic tissue, and this woman went on to have a remarkable recovery, something that she was dealing with for years. Literally at the first post-op appointment, she said, I don't know what you did to me, but I feel like a new person. This feels so different. So
wow.
Very, very, very amazing. Yeah.
Now you said countless. Does that just amaze you?
It does. I use amniotic tissue all the time, and I've used it with countless patients. And what I've seen is people that have come to me and said, my pain was not that bad, or my pain was nothing like a friend of mine. My inflammation is not that bad. My friend had a very different story. Or,
right.
In my field, maybe I operated on one foot and someone else operated on another foot. And the experience that they had with me was better, which is amazing, which is great. As a physician, that's what you want.
Yeah.
Also, just scars, healing, and how things look. People are very concerned with that.
Right.
And I truly believe that these tissues help the whole healing process and eliminate some of that scar formation that we can develop and improve outcomes and make these incisions look better.
Well, explain that to me, because I'm not a doctor. When you say make the incisions look better, how?
So a lot of people are concerned with a scar. You put an incision, you put a blade on the skin, you have a scar that results from it.
Right.
So these tissues, what I've found, have decreased that scar formation. So cosmetically, these incisions just look better, which is really important to many of us.
Now, do you tell people what you're doing? Have you introduced and saying, look, I'm using this kind of a tissue in my practice?
I do. I always educate folks, and I say, hey, there's this tissue called amniotic tissue. This is what it is. This is where it comes from. And this is something that I would like the opportunity to use, but I would like your consent.
Okay.
And again, my practice is mostly in the surgical setting, and I will educate people on what exactly it is. And to date, honestly, I haven't had a single person say, no, I would not like you to do that. I think after people are educated on what these products can offer and what they can do, people are interested in that. They want that. They want to have a better outcome, and they want to know more about it and see what it can do to help them.
Well, truly, if you said that I could heal faster, get back to work with less pain, I would go, I'm in, I'm in.
Right.
And the crazy thing is there doesn't seem to be any side effects. And that's what's phenomenal for me.
Yeah, to date, I have not seen a single side effect. I haven't seen a single allergic reaction. I haven't seen a single side effect. And I think that that's rather important.
So what would you say to other doctors who haven't discovered this yet?
You know, I would tell other physicians this is something that I think you should get educated on, that you should look into, and see if it's something that you could incorporate into your practice.
Right.
Maybe talk to one of your fellow colleagues, talk to another physician who maybe is using these products, and see if this is something that can be incorporated into how you practice medicine.
All right, now in terms of patient education, you know, I think we have a very odd idea of what this therapy is. And what do you tell people where it comes from?
I tell people that this comes from a fetal donor, that these products are safe, and they're derived from placental tissue.
So it's not baby. It's got nothing to do with baby. It's all
Right.
it's all the sac that the baby comes in, which normally, I mean, I gave birth to twins. We throw that sac away, correct?
Right, donated tissue, yeah, that has not been harvested in any fashion or form in that sense,
Right.
that some people think.
Well, and it's important to know because, you know, we trust doctors. So we're looking at you going, help educate us, help inform us. And I love the fact that you were skeptical when you first heard about it.
Mm-hmm.
Because I think listeners to this program are going, how do I know it's right for me? How do I know it's real? It sounds too good to be true. I mean, we're talking about regenerating tissue. I mean, have you seen cartilage grow back in areas?
I have, yeah, I have. So I think what's important here is amniotic tissue is tissue that can then differentiate into various other forms of tissue. So I've used this product to help heal bone, to help heal soft tissue, which is ligament, tendon,
Right.
and to help regenerate even some cartilage. So I've used this amniotic tissue to help regenerate bone, to help regenerate soft tissue. When I say soft tissue, I'm referring to ligament, tendon. Amniotic tissue differentiates into other tissue, and it's those other tissues that are involved in the growth of bone, involved in the growth of soft tissue.
Mm-hmm.
So in my practice, I thought, well, why wouldn't I use this to aid with bone healing, to aid with soft tissue healing?
Right.
And that's exactly what I've done.
See, and I can imagine that you would use this with everyone that qualifies, that seems right for it. But what a great concept, that it knows whether it and that's the part that gets me kind of excited, because it seems to heal the bone when it needs, or the tissue when it needs, or the ligament when it needs. It seems to know where to go.
Right, you're giving it that edge. You're giving it that extra potential to heal faster, to heal better. And I think that's important.
What else would you want to say to somebody listening to this program who maybe in your case has an ankle or a foot problem, maybe they've been dealing with it for a long time? What would you recommend?
I would recommend that you seek a professional opinion and really understand what's wrong with your ankle, what's wrong with your foot.
Right.
And whether it be a soft tissue injury, a bone injury, whether it be a post-traumatic injury, whether it be an athletic injury resulting with this post-traumatic injury, and get educated on what you can do to help.
So in your experience, one, you deal with traumas, so that's when something happens right away.
Yeah.
But people who've been suffering with pain for a long time, have you
Okay.
seen it work for them too?
Yes. Okay. So I think it's a perfect alternative to one of those patients that comes in that says, "Hey doc, I've had this chronic pain for years. I've tried everything. I've tried physical therapy. I've tried surgery. I've tried corticosteroid injections. I've tried you name it." This is an alternative that you can offer to those folks, and there may be benefit to that. And I think that that's a really critical point to keep in mind.
Good. Do you deal with neuropathy?
I do.
Explain what neuropathy is to me.
So neuropathy is the result of injury to nerve tissue, which typically causes numbness, tingling, and pain, especially in the extremities. So you can see it quite a bit in the lower extremities, and with some disease states, it can be the result of those states.
Okay, and have you seen this type of therapy affect that?
Yes, I have. Yeah,
How?
I've seen improved sensation and decreased numbness and tingling and pain.
So if somebody comes in and they're dealing with neuropathy, and I know many people who are dealing with it. My mom was one of those people. And you come in and go, okay, what do I do? And you would apply this kind of a therapy to them?
It's definitely something that I would consider. Yeah,
Now,
absolutely.
in your experience, is that a therapy that lasts? It's a one-time therapy, isn't it?
You know, the best patient testimony that I can think of is a patient that had nerve pain for many, many years, chronic nerve pain in her legs. And I performed surgery on her, and I did what's called a decompression of a nerve, where I freed a nerve from all this scar formation
Right.
that had formed around that nerve. And then after that, I used amniotic tissue to help decrease scar formation and to limit adhesions around that nerve. She did remarkably well. that particular patient I haven't seen in a couple years.
That's the best. You
Yep.
know what? We love you, Doc, but I'm happy not to see you except at parties.
Right.
How about age-wise? Have you seen people who are advanced, whether it's 80, 90 years old, get results?
Yeah, I've used amniotic tissue across the board, from teenagers to folks that are elderly in their 80s, even in their 90s.
Here's one of the problems that I found as an adult. I don't know where to go. I don't know who to talk to. So I go to the web. I talk to my doctor. You know, one of the problems, we go to our doctor, he has 5 minutes for me. He kind of looks and says, yes, no, you know, we'll cut you here, we'll do that. If there's this kind of an alternative that is relatively non-invasive, and I think, you know, relatively non-invasive versus surgery, as an option, it's something I think everybody should know about.
Right.
And that's what this program is about, whether it's the free consultation or the free seminar, to go and get educated. And listening to someone like you who incorporates it in their practice, it gives me a sense of, okay, you know what, now I need to go check it out for myself.
I think it's important to keep in mind that, especially in your older population, this is something that you can add as an adjunctive. You can add it as something that augments or reinforces what you're doing,
Right.
especially in a population where maybe there's some guarded healing, or maybe they're not going to heal as well.
Right.
So in my practice, across the board, younger population, older population.
How happy are people when they're moving and they feel better about their legs and their feet?
So happy, and that's a feeling that as a physician, you can't put a price on. People are feeling better, they're more mobile, they come to you and they say, hey, I cannot believe how much better I'm feeling. This is something that I couldn't do a month ago, a year ago. You've really touched someone's life. And I think that that's important, and I think that that is why we do what we do. When you have that type of an experience and when you affect someone's life in that way, you can't put a price on that as a physician. It's something that you strive for, it's something that you feel good about, and it keeps us going, and it makes us so happy to do what we do. One more thing that I'd like to touch on, and I think this is important. As a surgeon, I want to be in the operating room as much as possible. And I often joke around with my patients and I say, I'd rather not be in the clinic, I'd rather be in the operating room, and I'd love to do your surgery. And I take very much pride in doing that. This is an option that you can offer folks even prior to surgery. And I think people really respect that. The population, the patients that I see, oftentimes I've heard, you know, Doc, I really appreciate you telling me that. I'm scared of surgery. I'm not sure if that's what I want to do.
Yeah.
And you're saying to me, hey, this is something else that I may be able to offer you, and you may get improvement from this, and this may work, and this may give you an outcome that you're happy with, and that avoids surgery. As much as I want to do your surgery, as much as I want to cut on you, and it's a joke that I have in the office, this is something that's an alternative. And a lot of people will say to me, I really appreciate that. This is something that I think I want to try out and see how I do with it. Or you know what, it may be a person who just can't have surgery at that given moment, whether it be occupation or whatever it may be.
You know, I'm almost in tears.
This is another option.
I'm almost in tears because 20 some odd years ago, I had an ACL surgery, and my recovery was a year and a half, the worst year and a half of my life. I know the surgeon meant well, he did great, my graft was awesome, but my recovery was so bad and so long that it destroyed part of my career. I just, after 20 some odd years, shattered my graft. I went in for a consultation, and you know what the doctor said? Bam, need to do surgery. It was not even an option. He didn't say to me, you could possibly have an alternative on your knee before I cut you. So listening to you and listening to everyone else who sat on this couch so far, I'm actually going to go in and get this done on my knee.
Yeah.
Because surgery may be my only option eventually, but thank you so much for saying that, because at least I have a step before that, because it scares me. And I know it works, but it's a long recovery.
Absolutely. And as a surgeon, and I think most surgeons in general, we love the operating room. And we, almost part of us kind of forgets what it's like when someone says, hey, you're going to need surgery, or I think you need surgery, or I
Right.
want to operate on you. This is something that I think comforts people. It helps people feel better. Well, there's an alternative. Okay, maybe I can do this and avoid surgery. Even knowing that they may still need surgery, at least this is another option that you can offer.
But do you think if you have it before surgery, you're more likely to recover faster? Is that what you've seen?
That's a possibility. It certainly is. I've seen some remarkable things with these amniotic tissues and grafts, and absolutely, it's an option. It's an option that may make the outcome better.
Right.
It's an option that may avoid surgery completely. I'd
See,
say
I love
yes.
that you're a surgeon saying that, and I do also want you to add that this is not for everybody, and that it doesn't always work, because I think it's very important that we don't promise or overpromise. I love that we underpromise and overdeliver.
Absolutely, I agree with that, and I always tell folks that. I always tell folks, listen, I don't know if this is going to work, but I've had great experience with it, and there's a chance that it will. And when you look at the science behind it, you can't help but believe in it. And then when you see it clinically, when I have the physician's assistants or the medical assistants and the nurses that work with me and say, hey, Lou, what'd you do differently? You know, this looks remarkable. Post-op week 1, post-op week 2, swelling looks better, inflammation is down, pain is better, and the incision looks as good as it looks. What did you do? So, you know, I always explain that to people, and I always tell people that this is something that you can definitely try, and this is something that I would really like to incorporate into how I treat you.
Right.
However, I can't make you a guarantee that it's going to work. I can't tell you that it's going to solve all your issues.
Do you make house calls? So nice to meet you, Dr.
So nice
Lou.
to
I
meet you as well.
appreciate
Thank
your
you.
time. This was awesome.
Thank you.
And, you know, it's up to you. You get to make a decision about your health, your healing, your future. Do you want to live happy, healthy, and perhaps be pain-free? Now, while I can't make any direct promises, I will promise you this, that you need to go to a seminar. You need to go to a free consultation and take a look at what your options are, because I know that you don't deserve to live in pain. None of us do.